Whether you're just starting out in nursing school or already working on the floor, one thing's clear. Medication administration is a huge part of nursing. But behind every med pass, there's an entire system at work, one that involves prescribers, pharmacists, nurses, and more, all working together to make sure medications are used safely and effectively. In this video, we're breaking down the hospital administration use process, from prescription to administration. We'll look at where nurses fit in, how to prevent common errors, and why understanding the whole process is key to patient safety. Let's take a closer look at what really happens behind the scenes and why your role in this process matters more than ever. In the hospital setting, nearly every patient receives medication at some point in their care. But how does that process actually work, from the initial order to the final administration? Let's walk through the 3 key steps in the medication use process. First, the provider writes the prescription. Second, the pharmacy reviews and dispenses it. Third, the nurse, that's you, administers the medication and monitors the patient. Each step has built-in safeguards to promote safe and effective care, and as nurses, we're the final checkpoint. Let's take a closer look. First, prescribing the medication. When a patient's admitted, the care team determines what medications are needed. This is where medication orders come in, written instructions that tell us what drug to give, how much, how often, and how to administer it. So who can prescribe medications? Physicians do, physician assistants do, advanced practice registered nurses do, and that includes nurse practitioners, nurse midwives, and CRNAs. These orders are typically entered electronically, but in some settings, or if the system's down, they may be handwritten. Want to dive deeper into writing and interpreting medication orders? Check out the next video at nursevideohub.com. Now, for registered nurses who don't have prescriptive authority, if you notice a clinical need for a medication, you're responsible for bringing it to the provider's attention, but they're the ones who will write the actual order. Errors can take place in this prescribing phase. You might see incomplete or vague orders, illegible handwriting if it's been handwritten, incorrect dosages, medications that are contraindicated. While we don't write orders as RNs, we do provide critical information that helps providers make safe prescribing decisions. Things like changes in vital signs, new assessment findings, abnormal labs, or patient concerns. You're at the bedside. Your voice matters. The next phase is the pharmacy reviewing and dispensing the medication. Once the order's in, it heads to the pharmacy. Here, pharmacists verify the order for safety, interactions, and dosing, and then prepare or dispense the medication. Keep in mind, though, that the pharmacist isn't at the bedside. They may call you or the provider if anything in the order needs clarification, or if they need more patient information to ensure the medication is appropriate. Don't hesitate to reach out to your pharmacists. They're a fantastic resource, especially when it comes to drug mechanisms, side effects, and compatibilities. Errors can take place in the pharmacy. Some examples include incorrect transcriptions, filling the wrong medication or strength, or delivering meds to the wrong patient. That's why communication and careful double-checking are so important throughout this process. And the final step is medication administration by the nurse. Now it's your turn. Once you receive the medication, your role includes reviewing the order, assessing the patient, administering the medication, and monitoring for effects or reactions. You follow the rights of medication administration, including the right patient, the right assessment, the right drug, the right dose, the right route, the right time, the right documentation. And most importantly, you monitor how the patient responds. Does the medication do what it's supposed to? Are there any adverse effects? Unfortunately, this is another point where errors can happen. For example, giving the wrong medication, giving it at the wrong time, using the wrong route, administering it to the wrong patient, or missing signs that the medication isn't appropriate in the moment. Here's a real-world example. If your patient's blood pressure is trending low and you're about to give an antihypertensive, pause, reassess. Is it still appropriate? Advocate for your patient if it's not. Nurses are the last line of defense. As nurses, we're the final step before a medication reaches a patient. That means you need to read every order carefully. Don't assume. Verify if there's any questions. Speak up if something seems off. And look up medications you're unfamiliar with. If you're still in nursing school, keep studying your pharmacology. It's tough for a reason. Use every opportunity to learn how drugs work, what to watch for, and how they interact. And yes, your pharmacy team is always there for you. When in doubt, ask questions. Key takeaways. Before we wrap up here are a few things to remember. First, collaboration is key. Nurses are a vital part of the interdisciplinary team. Share what you see, advocate for your patient, ask questions. Second, know your meds. Build your pharmacology knowledge, use available resources, and stay curious. And third, verify orders every time. Check that the medication dose and route all make sense for your patient at that specific time. Medication administration is a huge part of nursing. Your role in the hospital medication use process is key to patient safety. Thanks for watching. If this video was helpful, give it a like, share it with your classmates or coworkers, and subscribe for more nursing education content. You can find more videos at nursevideohub.com. Watch, learn, and care.